Good morning, everyone, and welcome to our webinar, The State of Ageing 2023 to 24, Understanding Ethnic Inequalities in Later Life. For those of you who don't know me, I'm Gemma Mooland, Deputy Director for Research, Impact and Voice at the Centre for Ageing Better. And I'm joined today by our speakers, Jabir Butt, Chief Executive of the Race Equality Foundation, Nadia Siddiqui, Group Member and Director of Women's Voices CIC, and Ruth Edson, Learning Manager at Manchester Art Gallery. And last but not least, Sarah Wilkinson, Evidence Manager at Ageing Better. So some housekeeping notes from me before we start. We are streaming this session live on Ageing Better's YouTube channel, and the webinar will be available to view on demand straight after we've finished. All live attendees are in listen-only mode, but please do submit questions if you have them. So you can do that by posting them on the Q&A section. So there's a Q&A button at the control ribbon at the bottom of your screen, and we will have time for those questions and answers right at the end. You're also welcome to use the chat box if you've any other comments or responses that you'd like to share throughout the duration of this webinar. So today's webinar follows on from our recent State of Ageing report, which was launched in November last year. And the report has highlighted some significant inequalities affecting the lives of older people from different ethnic backgrounds in England today. These inequalities manifest across a whole range of different areas, from housing to health, caring responsibilities, financial well-being and jobs. So this morning, we're going to spend a bit of time exploring some of the data in State of Ageing, perspective and expertise on these issues and their thoughts on what needs to change. So without further ado, I am going to get us started with the presentations, and I'd like to invite Sarah Wilkinson to turn on her camera and to share her presentation.
Good morning, everyone. I will now just share my presentation, which will introduce us to some of the data, as Gemma said, some of the data in the State of Ageing report that we published back in November. So, yeah, I'm just going to give this overview and hopefully it'll set the scene for our guest presenters that we have speaking today as well. So I make no apologies for starting with talking about health. We know that there are big health inequalities. It's probably the type of inequality that lots of us think about when we think about ethnic inequalities. And this chart may be familiar to some. It shows the percentage of women by age group and selected ethnic groups who say that their health is bad or very bad. And health inequalities are a good starting point in that they illustrate some recurring aspects that we can see across a range of measures. Firstly, the chart shows that the percentage of women reporting bad health starts to divert at young ages, showing that by the time people enter later life, they bring with them a lifetime of inequality. And secondly, this also shows that the percentages are different for women in different ethnic groups, so that the percentage of Bangladeshi women aged 50 to 64 who report bad health, which is 22%, is the same as the percentage of white British women aged 85 plus, a gap of 35 years. However, if you look at the line for Black African women, we see that that's not too dissimilar to that of white women. And these variations between minority ethnic groups mean that on average, the gap between BAME women and white women is, and I'm putting this in inverted commas, only 10 years. This illustrates the inadequacy of using data which uses Black and Asian and minority ethnic women as a single category, BAME, because this both masks differences between minority ethnic groups and also underestimates the gaps for many. Thirdly, research that we've carried out ourselves shows that racism has a direct effect on ethnic health inequalities, as well as the indirect effect of the worse socio-economic position of many minority ethnic groups. This may be the case for other inequalities, but there's often a lack of evidence on this, and we'll probably return to this topic. The rest of this presentation will mainly focus on how inequalities are linked with socioeconomic backgrounds through poverty, homes, work and caring. And all these aspects are linked to health. So health inequalities can be seen as a barometer for wider inequality in society. Looking first at poverty, this chart shows that since 2012-13, the number of pensioners living in poverty has steadily increased, and now almost 1 in 5 pensioners, 18%, are living in relative poverty. Our analysis of households below average income data shows that people for people aged 50 and over, those with Bangladeshi and Pakistani backgrounds experience the highest rates of poverty, defined as less than 60% of median income. And around a quarter of people aged 50 and over from these ethnic backgrounds are living in deep poverty. That's less than 50% of median income. For this data, sample sizes are relatively small, so this should be seen as indicative, and this is an area where we definitely need better data. However, looking at the poverty, looking at these charts, the poverty figures are not surprising. These charts show that show the average income of pensioners, and it shows that the average income of Asian pensioners is only £422 per week. That is 72% of that of white British pensioners, who on average have an income of £590 per week. We also know that on average, people with minority ethnic backgrounds are underpensioned, only receiving 62% of the average private pension. And again, this figure will hide big differences between ethnic groups, as does the figure that I've just talked about Asian people, because that includes a wide variety of groups within that. The causes of lower private pension provision are clear. Disadvantage faced through working life includes fragmented working histories, higher self-employment rates, and the ethnicity pay gap. Recent data from the Fawcett Society shows, looking at the ethnicity gender pay gap, shows that Bangladeshi women earn on average 28% less than white men per hour, and that doesn't even take account of part-time working, that's the hourly rates. These, along with migration histories, also affect national insurance contributions, and hence the average state pensions are lower for Black and Asian pensioners, although other benefits, including disability and income-related benefits, are on average higher. These do not make up the shortfall. And of course, here we're talking about incomes in a time of rising prices, and the impact of the cost of living crisis on poorer people cannot be ignored. Our age analysis of data from the Aberdeen Financial Fairness Trust found that the financial well-being of people aged 50 to 69 was strongly associated with their type of housing tenure. The people most likely to be in serious difficulties or struggling financially are those in rented accommodation. And we know that older people in minority ethnic communities are much more likely to still be paying housing costs. Among people aged 50 and over, only 8% of people with a Black African background and 19% of people with a Bangladeshi background own their own homes outright, compared to a much, much bigger 54% of the total population of that age group. So we can conclude that the cost of living crisis is significantly compounding the existing inequality, including ethnic inequalities. And this quote from State of Aging clearly shows how the cost of living crisis is directly linked to health. I'll give you a little time to read the quote before moving on. Another important connection between renting and health relates to housing quality. A high proportion of privately rented houses are non-decent, that is, they pose a serious threat to health and well-being. And this particularly affects the oldest renters. The cost of poor quality homes for the NHS is estimated at £1.4 billion per year. And as we've seen, certain ethnic groups are more likely to be affected by this than others. More than 1 in 5 people aged 50 and over from Black African backgrounds privately rent, compared to fewer than 1 in 10 overall. So this brings us full circle to talking about health inequalities again. Another aspect of health inequalities is how that affects families through unpaid caring. 50 to 64 is the peak age for women to provide care. Unsurprisingly, women from minority ethnic communities, in which older people are most likely to report poor health, are also the most likely to provide the highest levels of care, that is more than 50 hours per week. Providing high levels in care obviously affects availability for work, but in turn is also linked to poorer health of carers themselves. So we can see that all these factors are connected: health, finances, work, homes, and caring. And this means that older people from some minority ethnic backgrounds experience worse health and less financial security than average, affecting their prospects for a good later life. Why does this matter now? In the State of Aging 20 to 23, we chose to highlight ethnic inequalities where we had the data available, because our vision at Centre for Aging Better is for a society in which everyone lives a good later life, and this cannot be achieved where there are significant inequalities between groups of people. Our analysis shows that the older population is becoming more ethnically diverse. The number of people aged 60 and over with Black, Asian and minority ethnic backgrounds has increased by 80% since the 2011 census. And looking at the increases in the number of people with ethnic minority backgrounds among younger age groups, we can see it is set to become more diverse in the future. I'm finishing with this quote from State of Aging because ultimately this isn't about trends and numbers, it's about people's lives. And as we've seen, people age with their histories of inequality. So we need to be planning now for a more diverse older population, aiming to reduce gaps while people are as young as possible, challenging policies and practices that perpetuate discrimination, and putting measures in place to support the diverse needs of older people. But the need for some people is urgent. So in the absence of wider public policy, we all need to do what we can to address ethnic inequalities in ageing, in work and in our communities. And that I'm going to stop there and hand back over to Gemma.
Thank you so much, Sarah. That was a brilliant start to today's webinar. I'd now like to show you a short video, if the technology wizards allow. And in this video, we hear from older people from across the country, and we ask them how they feel about different issues facing our ageing population.
As soon as you get to retirement age, you are treated discourteously, you are ignored, and I think it's because of the biasness of society.
They've known since the 1950s, when the present older people were born, that there was going to be a problem when we all retired. Nobody complained when we were all working and putting loads of taxes into the system, but now we're all retiring, we are suddenly perceived in some quarters as a burden on society.
Everyone thinks that we've got resources at our age, and actually I have to say I am fortunate in that when my mum died we paid off our mortgage. Having housing security is a huge relief of emotion. There's one less thing that you don't have to find every month.
Not all old people have got money. They've not all got money. They've paid the taxes, they've paid their insurances, but if some old people have not been in pension schemes, then they're just struggling on the pension.
I have to say, especially in this country, out of all the countries in Western Europe, I think you've got the lowest chance of aging well.
If you talk to somebody in their 80s or 90s and you discover that actually a lot of them have lived long, fascinating lives, they've done loads and loads of stuff, achieved amazing things in their life, and yet by the time they get to that age, they're just seen as this sort of amorphous mass of old people that are some kind of problem to society because they're a drain on the national resources. So they're not seen as individuals.
There's a lot of improvement needed for older people.
If we treat older people properly, younger people will also get treated properly, and various diverse communities will also get equally treated properly. So I think it is important that we as society change.
It's time that we're not working in silos. It's time that housing is not working on its own, or health, or social care.
I am not the politician, so I don't know whether I am. I hope that there is a change. I hope that they listen to what people said.
It's not just about putting a bit of money in here or a bit of an initiative in there, but seeing the big picture. And the big picture should be people have an equal right to a decent life, and it doesn't matter who.
For many people today, living longer is not just a hope, but an expectation. Many more of us are living into our 70s, 80s, 90s and beyond. But experiences of aging are becoming more unequal. While the state of aging suggests that for many people in England, aging could get worse, this is not inevitable. This is why it's crucial that we act now to plan for our aging population and ensure that the needs of older people are represented in policy making.
And I would now like to welcome our guest speakers to give their responses. And just a quick reminder, if you do have any questions based on Sarah's presentation or the video or on what you're about to hear, please do use the Q&A button at the bottom of your screen to start submitting your questions. So first up, I'd like to welcome Jabir Butt, Chief Executive of the Race Equality Foundation. Jabir, the floor is yours.
Thank you, Gemma, and thank you, Sarah, for the opportunity to reflect back on the slides and the information that you've shared. Apologies to all, I haven't got a set of slides to share with you. However, if you want to look on our website, you'll be able to find much of what I've got to share with you there. It's in a range of briefing papers that we produced over the last 10 years, and hopefully they're illuminating. Just a bit of advertising about the Race Equality Foundation. We're a national charity that promotes race equality in the provision of public services, and we've done this through looking at evidence on discrimination and disadvantage, trying to develop interventions that help us overcome that discrimination and disadvantage, and then sharing that through our written material, the training we do, as well as intervening in webinars such as this. Please do go and have a look at our website where the majority of that information is available. Can I start though from a wider point, and that is to do with the way we talk about racism and the impact on Black, Asian and minoritized ethnic communities in this country. I'm sure many of you will have seen or heard or perhaps even been involved in the discussions over the last 2 years that was sparked off by the third report into institutional racism in this country, which seemed to suggest that it wasn't as bad as some people were making out, and led to what's now become a comparatively toxic debate about it. And I do wonder sometimes about how we're going to see progress if we're not able to have an evidence-based conversation, a conversation that understands the impact of racism, but that also doesn't deny some of the other challenges that we face. And I think that's where we need to start off with, is firstly trying to understand some of the data behind this. Sarah's done a brilliant job, and the Centre for Better Aging has done a brilliant job and should be commended for it in trying to pull together all the available evidence. But we've got to remember that there are still some limitations in there. In particular, we struggle to look at minorities within minorities' experience. So, for example, the LGBTQ plus community from Black, Asian and minority ethnic backgrounds is rarely talked about in any research. It's really difficult to find anything that either says that their experiences are the same as others, or whether they're different, and if they are different, in what way. And you can identify that in other ways as well. People with a learning disability are now living longer as well, and we know that there are more likely to be people with a learning disability from Black, Asian and minoritized ethnic backgrounds. But again, the research is limited and the evidence is limited, and it does pose a challenge for us. However, the evidence has got better. Not only the census, but a range of administrative data sets now give us a real opportunity to understand inequality. But what we need to do is be careful about that discussion about inequality, particularly health inequalities. Too often when we're having a conversation, particularly a conversation with communities themselves, when we start talking about health inequality, we seem to end up focusing on what the NHS or health services are or aren't doing, or are doing poorly. Whereas the evidence from across the world is that actually our health status is more often than not impacted by other factors. Financial security or insecurity are a key part of that. The quality of housing you have and the built environment around you is a key part of that. The social and human capital that you're able to draw upon, such as the education system and what you've been able to secure through that, is a key part. And we need to understand, if we're going to have an impact on health inequality, that we actually address those factors, not just about what's happening within the provision of health services. Importantly, trying to understand those wider determinants of poorer health in older communities. We need to understand the impact of racism as well. There's clear evidence of direct experience of racism having an impact on, at the very least, on people's mental well-being. We know that it not only impacts you when that incident happens, but it actually has a long-term impact with people who are reporting poorer mental health over their life course as a result of that. But we also know that racism has a very direct impact on you through the jobs that you do. Black, Asian, and minority ethnic groups, as Sarah's pointed out, are more likely to, the Centre for Better Aging has pointed out, are more likely to still be in work later in life. And in part, it's because the jobs that they're doing don't give them enough resources to retire at the same age as their counterparts. Some of the industries also are much more demanding and impactful on their health. We certainly know household income plays a key part in how racism manifests itself, with Black, Asian, minoritized ethnic groups more likely to experience poverty, and that poverty to be carried on into the experience of income in later life as well. As importantly, we know that the experience of housing deprivation, not only because Black, Asian, and minority ethnic people are more likely to live in private rented accommodation, but they're more likely to live in parts of the country where the housing stock is comparatively poor. And we must remember, this isn't just unexplained consequences. This is a consequence of the way racism has operated in either housing allocations, or the way mortgages were given out, or the way places where people feel safe enough to live in. Importantly, there's been other changes that have been taking place, and part of that is the aging population amongst Black, Asian, and minority ethnic communities. And we need to start exploring some of that as well. And the Centre for Better Aging has done a brilliant job in doing that. But some things still need to be added to that. So, for example, we know that the lone parenthood is higher amongst minority communities, and therefore a household led by a lone parent is higher, particularly amongst the Caribbean community, and that carries on into older age as well. Whereas for the Bangladeshi community, there's still evidence of multiple generations living under the same house. In work that Nigel Deroney has done for us, he's pointed out that the greater risk of living in housing deprivation for minority communities is there, particularly for Irish and Gypsy travellers, are the most likely to experience housing deprived. But in one of Nigel's pieces, pointed out how that experience of deprivation actually follows you into later life. So in terms of white British communities, something like 7% of people over the age of 80 experience housing deprivation. But if we look at Black, Asian, and minoritized ethnic groups, something like 13% of over 80s experience housing deprivation. So that experience carries on through life. Importantly, minority ethnic older people also don't live in the same places where white older people do, and it's particularly important. Minority ethnic older people continue to live in urban settings, and often in the inner city part of those urban settings. Whereas if you look at white older people, they're more likely to have moved into the suburbs, but also moved to the coasts as well. And you can see some of that in some of the work that Nigel's done for us. This is an important, different dynamic, and particularly played itself out in the pandemic. When it was decided how the vaccine was going to be distributed, two things happened. One was a decision was made about over 80s being the priority for for the spread for the release of the vaccine. But also it meant that because over 80s, the majority of white over 80s lived in places that weren't in inner city areas. The inner city areas got less vaccine to begin with than other areas, and that difference in vaccine also reflected a lack of understanding of the impact of COVID-19, even though by then we'd had sufficient evidence to show the disproportionate impact that COVID was having, not only on higher rates of infection, but also higher rates of death as a result of infection. We still came up with a vaccine policy that didn't seem to recognize that that's something that needed to happen. Importantly, the COVID-19, while the disease itself has not gone away, it had other impacts as well. And some of the work we've published has demonstrated that emerging from the pandemic, Black, Asian, and minoritized ethnic people were more likely to be in housing arrears, particularly rent arrears as a result of that, and were more likely to be saying that they were behind with payments of other bills, such as electricity and gas charges as well. So the cost of living crisis actually comes on top of something that was already being a disproportionate impact on that group. So in the last couple of minutes that I've got, I just want to talk about what is to be done. I think the starting point has to be, and again, the Centre for Better Aging has to be commended, is that we need to change our understanding of the aging process. Some of the brilliant contributors to the video have pointed out being treated discourteously, being treated as being a burden, being treated as a problem. We need to change that understanding and recognize that we need to celebrate aging. Having people grow older is a sign that we've done something well, that it's a sign that the society is working and it's a success. And we need to start promoting that. But we also need to be clear about the impact of racism, and that action needs to be taken to address racism. So at the foundation, we've been calling for various steps to be taken, including a major program of social housing building. We think it's absolutely essential that we address the current crisis in housing that many communities are experiencing, but are having a disproportionate impact on Black, Asian, and minoritized ethnic groups. As Sarah's pointed out, those people who in older age are renting property are seeing a significant rise in the cost of renting. And what's happening in terms of the rental market is a direct result of our failure to invest in social housing, our failure to build sustainable housing that has a valuable impact. Beyond that, we really need to have a proper conversation about income security that doesn't present one competition between one generation and another, but to recognize that it's a human right that people should be able to live free from the tyranny of poverty. Poverty has a detrimental impact not only on your physical well-being, on your mental well-being, and how you're able to contribute to the society around you. And income security in older age is an essential part of that. And yes, it is a race equality issue because Black, Asian, and minority ethnic people, older people, are at greater risk of experiencing that poverty. So let's celebrate it, but let's not forget the scale of the exercise the scale of the work that we need to carry out. Thank you very much.
Thank you so much, Jabir. That was incredibly thought-provoking. And please do, as a reminder, keep those questions coming in the Q&A. We've seen a few come through, which I think some of my colleagues have been answering. And I'm sure Jabir has provoked some more thoughts in all of you. So please do pop those questions into that Q&A box. I am now really pleased to welcome our final two speakers. We have Nadia Siddiqui, who is the Uncertain Futures Advisory Group member and also a director of Women's Voices COC. And we also have Ruth Edson, Learning Manager for Communities from Manchester Art Gallery. So I would like to give you the space to share your presentation now.
Okay, thank you everyone. I'm just going to share my screen, hopefully. Yeah, thank you so much, Jabir and Sarah, for both your presentations. They've both been incredibly insightful and reinforced the findings of the programme that Nadia and myself are going to speak about. So I'm just going to give a couple of minutes context to Uncertain Futures, and then I'm going to pass over to Nadia, who is a member of the advisory group for Uncertain Futures, to share much more of her experience of being involved in the project, but also about her experience of working directly with women. So these are the 100 women who were part of the Uncertain Futures project. And this was a photo from a celebratory dinner where we brought everyone together to say thank you, but also to network with each other. So I'm just going to set some context. Uncertain Futures has taken place at Manchester Art Gallery in the centre of Manchester. You can see here that we've had 4 questions actually running outside the gallery for the last, since 2021, so the last 3 years. So Uncertain Futures is art as research and research as art, and they're both working together. So there's so it's a research project that's taken place in an art gallery, live in an art gallery, and you can see here that we interviewed 100 women in a booth that looks just like this. With we did actually have the blind down so people couldn't hear the interviews, and sign up saying interview in process, but for this photo we had permission to leave the blind up. And after every interview we transcribed it, anonymized it, and then it went on the wall for others to read. So Uncertain Futures began in 2019 with the artist Suzanne Lacey, who's an American artist who's been working for over 40 years in the field of socially engaged practice, which is around bringing people together to make social change. And Suzanne was due to have a retrospective at the Art Gallery and at the Whitworth Gallery. And we started to think about creating a new piece of work for Manchester that gave people in Manchester agency to make change. And we started to ask the question to lots of different groups: what are the inequalities that women over 50 face in relationship to paid and unpaid work? And this came out of previous consultation with all sorts of groups around issues around work for women over 50. And so Uncertain Futures then pre-pandemic started to work with different focus groups, and then during the pandemic we moved online and formed what is now the advisory group. So there's 4 different parts to 4 different key partners. There's Suzanne Lacey, the artist, Manchester Art Gallery, the advisory group, and then a research team from the University of Manchester and Manchester Metropolitan University. So why Manchester Art Gallery? Well, Manchester Art Gallery is a civic space. It's there in the centre of town, and our aim is to collaborate with partners to create social change in the city. So rather than always being a passive space where people come and view art, it's more about people in the city to actually take an agency and ownership of the gallery. And we've got our latest manifestation. There's been 3 iterations of Uncertain Futures, and the final one is a film that we've been making telling the stories of the 100 women who were interviewed. And that opens on International Women's Day, 8th of March. So we had 100 voices, and you can see here some of the demographics, but 63% were for Black, Asian, minority ethnic groups. And we worked really hard with the advisory group to recruit those women. So the advisory group, and Nadia will talk about this, really shaped who the 100 women were. And these were this is a sort of intersectional diagram of what we were looking at and what we were researching about access to work, in-work experience, is the impact of COVID-19, and then working towards retirement and ageing. So Nadia is going to talk more about the findings, but there are 4 key things that have come out of the 100 interviews, which is recognising the enduring contributions of older women, the causes and implications of fragmentation on women's lives, inequalities as obstacles to work, and very much a focus on how to create more certain futures. So I'm going to pass over to Nadia now, who's going to share more of her experience and her experiences working directly with many of these women.
Just need to pop yourself on unmute there, Nadia.
Sorry,
there we are, lovely.
Thank you for that, Ruth. I'll start by providing some information about Women's Voices, which is a not-for-profit organisation which I established in 2013 to strengthen the voices of women from diverse backgrounds. Immersed within our feminist, non-judgmental and non-discriminatory values and practices, the organisation's mission is to enable women to achieve empowerment, equality and inclusion. We also want them to overcome the barriers holding them back and to reduce the racism and discrimination at institutional, social, cultural and economic levels. The Women's Voices users group is largely from migrant communities who are generally living in poverty and poor housing. Some are victims of domestic abuse, many have caring responsibilities, some are asylum seekers, almost all are from families struggling with the cost of living crisis. Many live under the radar with little knowledge or experience of life in the UK. One of the women we have been supporting with lived experience of some of these issues, I'll call her Fatima. She was interviewed for the project. She came to the UK as an asylum seeker. She's a single parent and a full-time carer for her 2 daughters. Both have severe disabilities. Much of her time was spent attending medical appointments with her daughters. She felt very isolated and depressed. Whilst her asylum case was pending, she was unable to work. Recently, she was granted status. Unfortunately, she's still unable to work because of her caring responsibilities. In older age, she will no doubt be affected by pension poverty because of the limitations on her earning potential, which inevitably have an impact on her retirement income in due course. The value of working with women such as Fatima gives us a better understanding of the complex and varied issues that impact their lives, and this in turn helps us inform and improve the services we can provide to support them with a view to reducing health and social welfare inequalities. The women we see are often under-resourced, underrepresented and undervalued, invisible in the local community and within policy and decision-making networks and plans. Many of the women do not speak or write English, and much of our work is ensuring women have access to information and staff who speak their language, and we also offer culturally appropriate services. Uncertain Futures is a unique project because it conscientiously recruited women from many diverse communities, and the advisory board attempts to be a true reflection of the communities we represent. I am one of the 14 women on the Uncertain Futures advisory board, all of us over 50. We have a wide range of skills and a wealth of knowledge and expertise of working with ethnic minority communities. There were times during the course of the project when we had challenging discussions, and if we ever needed support, Ruth was always available. Being part of Uncertain Futures has truly been an amazing journey for me. Each member of the board has strong values and compassion to fight for justice for the most marginalized communities we serve. During our meetings, we were able to share stories of women struggling to survive because of their circumstances and living without support. Some of the members shared their own personal journeys or highlighted issues affecting women in their communities. The research led by Sarah Campbell from Manchester Metropolitan University and Elaine Dewhurst from Manchester University has resulted in data which is unique because it represents the diversity and lived experiences of 100 women over 50 who have been through so much pain, trauma, and different levels of discrimination and inequalities just to survive on a day-to-day basis. The research findings have highlighted the impact socioeconomic factors, racism, discrimination, and intersectional inequalities have on the lives of women over 50. Our findings were that women were not valued or recognized for the contributions they made as older women. They had fragmented lives. Some had caring responsibilities. Some lived with disability or with chronic disease. Some were in work. Some did not have the right to work. Some did volunteering. Women seeking asylum are normally not allowed to work, and their cases can take years to resolve. During this time, their physical and mental health will be affected, and if and when they are granted status, they may struggle to find a job. The financial insecurity as a result of not having the right to work will have an impact on their retirement, and they will suffer from pension poverty. The Uncertain Futures team has been sharing the report at local and national levels, highlighting our final recommendations. As an older woman myself, I can relate to almost all the issues we have addressed in the research. I came to the UK at the age of 15 as a refugee from Uganda. I experienced racism and discrimination when I came to the UK, and I was often referred to as a Paki, or was told you smell of curry. My experience has been similar to that of some of the 100 women interviewed for the project. I believe it is essential to involve our communities in any decision-making policies to improve the lives and working conditions of women over 50 who are marginalized and living under challenging conditions. To address the inequalities faced by the women, we must provide ESOL classes and community engagement. We also need training to raise awareness amongst people around retirement and pensions and rights at work generally. And in the longer term, we need to strive towards a fairer and equal society. Thank you.
Nadia, thank you so much for sharing those insights and reflections, and Ruth as well for scene setting. We're now going to move on to the discussion. So I'd like to invite all our speakers to turn their cameras back on, and you can keep yourself on mute and come in to answer the questions. Just to say also that the brilliant work and reports that have been mentioned throughout today have also been posted on our chat. So if you want to open those links and go back and read those later, I strongly recommend that you do. The work of this Uncertain Future and well worth the read. So do keep your questions coming into the Q&A box. I will kick us off with a couple of questions, some of which were submitted ahead of today's event. So I think one thing that's really clear from the discussion today is issues and areas that we need to be considering, and a lot of different areas for action. So this is a tricky one, but where should we start? You know, what would be your top priority area for action in order for us to start addressing these inequalities that are manifesting in later life? If I could ask, I'll ask Sarah to come in first on that one.
I think, yeah, I'm glad to have the opportunity to answer this, because obviously in my scene setting, I didn't get to the kind of what we can do bit because of limited time. So I think it depends largely at what kind of level people are working at and what kind of connections people have. It's undoubtedly an issue that we all need to look at, and we need to kind of work at community level, at kind of local authority level, regional level, national level, wherever we can work. One of the things from our point of view that we talked about, Jabir is right, we are getting better evidence, but there is still big evidence gaps. And that's largely because there is real inequality even in data collection and data recording. So we need to get better at doing that to kind of help formulate national policies and look at where some of the levers for change might be nationally. So we definitely need to have better data. We're also calling for, as I know Race Equality Foundation are, a national race equality strategy, because this is an issue that cuts across all, as we've seen, housing, caring, health, finances. It's not something that can be dealt with piecemeal, or at least if it is dealt with that way, it won't be as effective as having national coordinated action. As we also want a commissioner for older people, a commissioner for ageing and older people that we're calling for. Likewise, because the issues across ageing cut across everything as well. So when you bring these two together, it's really important to have a coordinated response. Just one more quick thing is that I know there are people on this call from local authorities, and we would encourage people in local authorities to look at what's happening in their areas around age-friendly communities. They may already have an age-friendly community in their local authority area, or they may not. And I think there's a lot that can be done at community levels if that inequality lens is looked at when planning the work of age-friendly communities. And that needs to be really considered about, particularly as the nature of our communities will be changing and will be becoming more diverse. It's more important than ever that age-friendly communities consider diversity and inequality in their planning.
Thank you, Sarah. Invite any of the other speakers today to add their contributions. Nadia, would you like to come in there?
I think I agree with Sarah, because I think it's important to involve the communities. And the reason I say that is only a couple of weeks ago, we had a focus group with women at the centre, and none of them really were aware about the impact on their lives if they didn't understand about pensions and retirement. Because they're not working, they do not realize that what their future is going to, the poverty they might have to live in, and the struggles that they're going to have as women. Some are single parents, they're not working, they're struggling with children, they have disabilities, they have caring responsibilities, and many of them didn't really understand about pensions and retirement. And I think it's really important for everyone to take a responsibility, to have responsibility in raising awareness and educating people about, pensions and retirement and what the future is going to be like for them.
Thank you, Nadia. So it really highlights that importance of the sort of top level national strategy response to this, but also that direct conversations with individuals and communities and importance of action across all those areas. Sarah, were you going to come directly back on a point that Nadia raised?
Just to completely agree with what Nadia is saying, we are shortly going to launch our new financial security chapter, longer financial security chapter for state of ageing. And one of the statistics in there is looking at people eligible for pension credit that don't claim it. 3 times as many single women as single men are not claiming pension credit that could be eligible. So 450,000 single women compared to 150,000 single male men are not claiming it. So this is a real issue for women. And we know also that it's particularly high at particularly low in terms of claiming among some ethnic minority communities. So we can see there that there's an instant kind of inequality there that could in some ways be addressed fairly easily, in that it's a benefit that people are eligible for, and it's a matter of connecting those people with that benefit to try and bring more people out of poverty.
Jabir, I think you're about to come in there.
Yes, if I could come in, clearly support all the things that Sarah and Nadia have said, but I do think we do need to try and change the conversation about Black, Asian, and minoritized ethnic communities in here, partly to make sure that we have a conversation about racism that properly understands the impact it has, but also then identifies the things that are going to help us overcome that, whether it's income security, whether it's better housing, whether it's better education, and so on. Without that, we're not going to be able to do it. But most importantly, I think without that, we're not going to actually recognize the contribution Black, Asian, and minority ethnic people have made to this country already, particularly this generation. I have a long-term friend who, whenever I meet her, reminds me that her father was part of the team that installed all the drains in Milton Keynes, where I live. Now, you sort of lose sight of how important those contributions have been, both from the Windrush generation, but also those generations that arrived from South Asia in the 50s and 60s to build the country that we have now. And unless we do that, we continue to have this false dichotomy about us and them, and who is deserving and isn't deserving. We need to recognize the importance, not least because we're now going to find more and more of the working age population are from minority communities, because we're already 1 in 5 of the population, and it's going to be an important part of our future.
Point incredibly well made. Thank you, Jabir. And I can see that some of our audience members are agreeing with that as well. A related question that came in advance of today's webinar was about how do we progress the ideas and evidence that we're generating through our various reports and bit of research into grassroots activity and awareness. And that was a question from Tim in the Elders Council of Newcastle. So has anyone got any reflections that they'd like to share about what do we do with all of this information that we have at our fingertips and that we're aware of? How do we generate grassroots activity off the back of that?
I mean, I can say a little bit about the impact of the interviews, the 100 interviews and the Uncertain Futures project. So on a very local level, we've been working, the 14 women on the advisory group all work in communities, and therefore will be using the findings and the recommendations from Uncertain Futures to and disseminating that through community. So there's a very kind of, there's a definite kind of immediate impact there, and I think that was very much part of the methodology. It's the people who are doing this work are very much part of the project, and so the work that Nadia explained shows how that's sort of disseminating into communities already, and the awareness and the confidence to do that. But then on a local government level, we are starting to work with our Manchester strategy team, and that's they're just working on their next 10-year plan. And so really thinking about where women over 50 and work sits within that. And so we're having more conversations at the moment, and that's come out of the report. And I think being in such a public place and putting it in the platform. And then nationally, I think it's now about taking these findings and working with organisations like Centre for Ageing Better and all the other amazing campaigns and living wage campaigns, all different pension campaigns, and coming together to make change. So it's a body of evidence rather than doing things kind of independently. So I think that's the way Uncertain Futures is sort of thinking, very much community level, then local level, and then beyond. So
Fascinating, Ruth. And I think, you know, such an interesting and important point there about the value of participatory approaches to research. The way in which you do your research actually is a really important route, and then ensuring that dissemination into local communities. And Nadia, you're a really good example of that, about the kind of conversations that you're having within your networks across Manchester as well. That does leave me, I think we've got time for one more question, and there was one that had popped up in today's through the conversation today, which was, do you have any recommendations for how service providers can best engage and consult with communities to encourage co-production of solutions? And I think that's really pertinent and reflected in some of the work of Uncertain Futures, but also I know Jabir, the work of the Race Equality Foundation, that kind of co-production approach is really important. So I'd love to invite either of you to share some reflections on how we can engage and consult with communities to enable better co-production. Any top tips?
Gemma, if I just quickly add, there's a lot of written material around, including material that we've produced around better engagement and better co-production, and it's worth looking at all of those. The work that TLAP have done in particular might be particularly useful in this. The thing that I would add, though, from our experience, is that many organizations, particularly service providers, still haven't overcome that question about representativeness versus diversity. The assumption seems to be that if you work with communities, you've somehow got to achieve representativeness. So if you've got Sikh communities, or if you've got Caribbean communities, or if you've got Nigerian communities, you've somehow got to do colour by numbers. We've got to have somebody from each of those groups to attend. And the reality is that representativeness will never be achieved, because the likelihood of you being able to engage enough people to do that is very slim, or have enough resources to do that is very slim. What you can do, though, is you can work on diversity. You can actually think about who are the communities out there, who are the people we normally talk to, but who are the people we're not talking to, and why are we not talking to them? And when you start asking those questions about diversity, you then do get better at engaging. So you do get better at, well, if there are particular groups that have been excluded, let's see how we can actually get out to them. And that's the second part. It's about going out rather than expecting people to come in.
Thank you so much, Jabir. And Ruth, Nadia, I'll invite you as the last contributions. Anything that you would add to that?
Nadia, do you want to speak? Yeah. Nadia, do you want to unmute and you can answer? Yeah.
Sorry, Jabir, I don't agree with you, because I think it's really important to include representation from the communities. I think you will see more often than not, women are excluded from those platforms because they don't have proper representation from the diverse communities that we serve. And I think they have to be involved in it. Yes, we can do the work that we need to do, but there has to be the community involvement in it. And I often see women are excluded from those spaces. And the reason why Uncertain Futures has been successful in the work that we're doing is because we have involved women at grassroots level and organizations that are representative of those communities.
Thank you very much, Nadia, and that importance of knowing what voices we're hearing and who we're not, and engaging those in that process has come through really strongly there. Unfortunately, we are now out of time. Thank you so much, everyone, for your contributions today. And I'm sure you'll all agree that that was a really rich and thought-provoking discussion. I'd really like to thank all of our speakers one more time, Sarah, Jabir, Ruth and Nadia. And please do take a moment, everyone attending, to tell us your thoughts about this webinar. We'd really like to hear your feedback. So pop that in the chat. And don't forget, this webinar, along with all our events, is available to watch on demand on our YouTube channel. And so that leaves me just to say thank you again to everyone, and goodbye.